Good evening, everyone. How are you all? Welcome to First Aid AMC Clinical free 2-week session again. Now, this is going to be your first class of the free 2-week session. And I'm sure all of you have got our schedule for the next 2 weeks. So today is one of the role play session that we are going to do based on the theory session that we had in our first trial class. And that was done just a couple of weeks ago, right? And then 13th August, so day after tomorrow, you're going to get another role play session, which will be just a random role play session. And there will be no topic, and we'll be just asking you to do a role play on some random case. And that's one of the kind of classes that we take in the course where we do random role play sessions on some of the important questions. And for that class, there will be a separate Zoom ID. So make sure you know what is the Zoom ID. So this Zoom ID will not be the same for that class. So I will provide the new Zoom ID for that session anyway. And then you will also get two classes on cardiology, and then we do another role play on cardiology. And then we will do another theory session based on pediatrics, vomiting cluster. So this is usually how we take our free sessions. But remember that when we start our course in the full rhythm, then you will be getting role play sessions more than what we are doing in the 2-week session. So you get 1 or 2 role play session each week to make sure that you understand how to do proper role play, and you can get enough chance to do role play with us and improve yourself. Okay. So last class, I couldn't do the role play. So today, our class is exactly based on role play on the topics that we have discussed, which was psychiatry, mental status examination. So do you guys have any questions before we start the session? And I can see a few of you are on the live stream on Facebook. So if you want to do role play today, we can't do role play on Facebook. So definitely, if you are interested, come to the Zoom. We have provided the Zoom ID and password. So you can definitely come and join the Zoom session, and you can do role play with us through this. Okay. All right. So about the course, if you guys have any questions, feel free to ask us at the end of the today's session. And we will also provide a bit of discussion about the course and what's going to happen in the next 5 months. And remember another thing, that this class is a part of your 5 months course as well. So this is not just a free session, it is a part of the course as well. So you are just getting this free because we want to provide 2-week session for anyone to understand how we take our classes. And then if you feel that, no, this is the right course for you, then you join us. All right. So let's start from some role plays. Good question, Dr. Godwin. What is the difference between mental status examination and mini mental stat examination? There is a huge difference between these two. Mental status examination is basically just doing a psychosocial history. So all the history that we have done last session, that will be the same thing. But mini mental status exam is designed for dementia patient or delirium patient, where you find out if the patient is cognitively impaired or not. So to assess someone's cognition, you do the mini mental status exam, which is a bedside screening test, which we will cover in our course with some other psychiatry classes. This is not the end of psychiatry session. You get another 4 psychiatry session with us. Okay. So mini mental status examination is quite different from mental status examination. Okay. Any other questions? All right, so today's class is not about theory. It's all about how you guys can start doing some role play. So I would appreciate if someone who has done some role play or you started your preparation, if you guys do the role play with us, then the others who are totally beginner, they will understand how to do this properly. Okay? So let's start in that way and see how you go. And I will also give you some idea that how it should be done. Okay? So who wants to do the first role play? Dr. Vinetha, very good. If you can unmute yourself.
I've done, sir.
Great. Okay. So for the role play session, what I'm going to do is that you will get, let's say like for today, you will get 2 minutes to read and prepare for the case. And then ideally in your exam, you get 8 minutes to do the case, but for purpose of your your prompt response and so that in the exam you don't run out of time, we normally do the role play in 7 minutes 30 seconds. Okay?
Okay.
So you'll get
Okay.
7 minutes 30 seconds to do the case and 2 minutes just to read. Once 2 minutes is up, I will ask you to start. So let me share the screen. So this is your case and your 2 minute time just started. All right, Dr. Vinita. So your patient name is David. You can start.
Hello, David. I'm Dr. Vinita. I'll be seeing you today.
So many cockroaches in Rome. Just can't believe I'm in a hospital. How come there is cockroach in a hospital? Just go away from me. Oh my God. Is this just a bullshitting with me? Who are you? Sorry.
David, I'm here to help you. And whatever you say will be between the two of us. And I may have to ask you
Sorry, I
certain
didn't catch your
questions.
name. So who are you? You are and why you are here? Can you just remove these cockroaches? It's because I can't stay here.
I'm Dr. Vinita, and I'm your HMO today. I'll be seeing you today, and I'm here to help you. So I need to ask you some
I
questions.
don't need any help. I don't need any help. My surgery is done. I'm done. I just want to go out of this hospital if you can't clean this room. So if you can please call someone and just clean it because I can't stay here. It's just full of cockroaches. Can't you see? Like there is cockroaches just around you.
Okay, can I ask you something? Are you sleeping properly?
Yes. Why are you asking that question? I'm not insane. I'm fine. It's just cockroaches all over. It was fine last night, and I can see all the cockroaches now. It's just full of cockroaches everywhere.
I'm sorry about that. Let me see how I can help you. So, are you taking your food properly?
Yeah, I'm fine. Everything is fine. And you can't ask me about like having food in this filthy rubbish room where there is all of cockroaches. Can't eat here. I just want to go home if you can't clean it.
I will do the needful, don't worry. And do you think your life is worth living?
Yes, definitely. That's why I'm having the surgery.
Okay. I can see from your notes that you have a history of alcohol intake. Can you tell me something more about it? When was your last alcohol intake?
That was 5 days ago.
Do you take any other recreational drugs?
No,
Do you have any thoughts of, uh, have you had any history of attempting to harm yourself in the past?
no,
Okay. Do you see or hear anything that others don't?
no, I'm not insane. I'm fine.
Okay. Other than these you said you are seeing cockroaches. So do you also feel them on you, or you can just see them?
No, it's crawling on my body. It's also crawling on your shoulder. Just have a look on your right shoulder, doctor. There is a cockroach there.
Thank you for pointing that out. Do you think someone is spying on you or trying to harm you?
No,
Do you think someone is controlling you?
no,
Do you think someone is trying to insert thoughts into your mind?
no.
Do you think you need some medical help right now
I
for
don't need
this?
any medical help. I just need a cleaner, doctor. Can't you just call a cleaner and just fix this room?
Okay, some of the questions I'm going to ask may seem strange to you, but please cooperate with me. If there is a fire in this room, what will you do?
I'll just run away. There is also fire in this room now.
What do you do for work? Like, how's your home situation?
I live alone.
Do you have any stress at work?
No,
Uh, do you have an active sexual life?
yes,
Do you have any other illness for which you're taking medications for a long time?
no,
Do you have any allergies?
no,
Any past history of mental illness? I know that you have already told me that you are not insane, but still, for completion's sake, I have to ask you some questions. That's why I'm asking. Do you have any past history of mental illness?
no,
Uh, Recently, did you have any fall,
no,
any fever history?
no.
Uh, so, how is your pain like? You had surgery 1 day ago. Is the pain controlled now? From the notes, it said that it's controlled. So, do you have any pain now, or is it okay?
It's okay. Oh, so I can't just stay here. It's too many cockroaches now. It's just getting more and more, doctor. Just clean this room, or maybe give me a new room because I can't stay here. It's just full of cockroaches.
Okay. I think I'm ready to present the findings, dear examiner.
Okay.
From the appearance, patient seems to be anxious, and speech is normal. He is the mood is again he's anxious, and there is a problem in perception. He has tactile and visual hallucinations. Uh, Thought is linear. The He does not have insight. His judgment is judgment seems to be okay, and there is no risk of suicide. The history is not fully reliable because he's having hallucinations. I was able to establish a reasonable rapport with him. So from the current scenario, since he is an alcoholic person who had taken alcohol 5 days prior, should be present a possibility.
No need. So all you need to do is to thank the examiner. So don't forget to thank the patient. Don't forget to thank the examiner because that matters a lot. So apart from that, Dr. Vinita, you'd have done well. So very good. You were calm in this kind of situation, which is really important because in exam, this kind of cases can be really difficult because the patient will push you really hard. So keeping the calm, keeping the main thing together is very important. Okay, so that's really good. So few things I would ask you to improve is, first of all, like in this case, if like I understand that patient is seeing cockroaches, and definitely we are not, but still because patient is concerned, just say that, please don't worry. I understand it must be very stressful for you, but I'm going to call someone to clean the room as soon as possible. You'll be fine. So say something which will calm down the patient, even though that doesn't mean that we are saying that we are also seeing the cockroach. If anytime anyone says that, yes, I can see the cockroaches, that's the time you will be in trouble. So just don't say that, but you can always say that it's like, this is where the empathy will come. So you will always say that, David, I'm so sorry to know that the cockroaches are here, and it must be very upsetting for you, as I can see. But I'm going to sort it out. I'm going to call a cleaner as soon as possible, but I need to ask you a few questions before that. If you can please sit down and just answer a few of my questions, and then we can sort it out together. And please be aware that whatever we discuss today, this is going to be confidential between you and me. Okay? So say something like that. Patient will be happy and they will not bother a lot, like how I have done. Apart from that, don't just ask alcohol first. It just seems that you're judging the patient by asking about the alcohol because patient is not being very cooperative with you. So keep the alcohol, recreational drugs for the end. So follow the format always. So in here, you can definitely start with cockroaches. So you can say that, can you tell me since when you are seeing these cockroaches? Duration is always important to get to a diagnosis, even though diagnosis is not a part here. So how long you are seeing this way? Or can you tell me since when you started seeing the cockroach? And then say that, has it ever happened in the past? No, doctor. Well, apart from seeing the cockroaches, are they also crawling on you? Yes. And also, is there any voices that you can hear by any chance? So a patient can get a little bit just or embarrassed if you say that. Just immediately after saying that, can you hear voices? Just say, please don't, please get assured that these are some screening questions for everyone. So please don't get or please don't feel judged by these questions. So in that way, patient will not say, do you think I'm insane? I'm not hearing any voices. So we just want to be prepared so that patient doesn't get judged anyway. So you have asked the hallucination question, and then you can go to the format. So you missed to ask about the mood question because that's a part of MSc. If you miss something in the history, do not say in the MSc presentation. The best way would be that, let's say you have forgotten to ask the mood. When you do the MSc presentation, just say, I'm sorry, examiner, I have forgotten to ask about the patient's mood, but the affect that I have observed seems patient is quite disturbed. And that way, You are not, it seems that you are being honest, and that will be much better than saying something that you haven't done. Okay.
Okay. Okay.
And then
Thank you, doctor.
you go to the mood, sleep, appetite, then ask about the suicidal thoughts. So do you think your life is worth living? Is there any chance you are having any thoughts of harming yourself or others? Then after that, if you remember the format, we ask mood, sleep, appetite, then the suicidal thought, then we go to the hallucination and delusion question. Hallucination has been already asked. Then you have asked all the delusion questions, so that was very good. And then you ask about insight, cognition, judgment. And then if you have some time, you can ask about SADMA and HETS and past medical history. Okay, so your
Okay.
history was pretty good. Just the format was not maintained, but I'm sure it will be once you do a lot of more role plays. Okay. Other
Thank you,
than that, before you go to the examiner, so when you finish your first task, always say, "Thank you, David, for all the information that you have provided. Now I'm going to talk to my examiner and I'll come back to you." Is that okay? So taking permission, saying, like, you can't just jump from one to another one without saying the other person. That also will not be a very good thing in the approach. So there is always a mark for approach. So these will be counted, that if you're saying thank you, if you're taking permission before stopping talking to someone. So those tiny little things matters a lot in the exam. Okay.
Okay.
After that, you go to the examiner. So you say, "Dear examiner, I'm going to present mental status examination of David, who is a 47-year-old patient, had a surgery for dislocated shoulder, but suddenly started to behave oddly in the ward and is starting to seeing cockroaches." See, this, you give a context. And after that, then you say appearance. So you always write the aseptic J3R so that nothing is missed. So you say in here, now appearance, you can't see me, so you can't actually say, but you will be seeing the person in the exam. So you talk about if the appearance looks, if the patient well-groomed, if the patient cooperative, maintaining eye contact or not. After appearance, you go to the speech. So you say that speech, in this case, speech was not really normal. You could say that it was a bit loud and pressured, right? So you can
Okay.
say that the speech was a bit loud and pressured and sometimes a little bit angry, right?
Okay. Okay.
But there was no, like, there was no disorganized speech. The emotion, if you ask the mood, patient would say that mood is okay. And then you would say the affect that I have observed was not congruent with the mood because I feel the affect was disturbed. Then in terms of perception, patient had visual and tactile hallucination. Thought form was linear. There was no delusion, so no delusion of reference, control, or anything. Insight was impaired because patient says he doesn't need any medical help, but cognition you didn't assess, so cognition was not assessed. Judgment was okay. And then 3R. Patient is a high risk because of active hallucination that he has got, or you can at least say moderate risk. Even though patient doesn't have any suicidal thought, still patient will be in a risk because of the active hallucination and the way
Okay.
he is acting. So you can say patient is in a moderate risk because of the active hallucination, but he doesn't have any active suicidal thought. Then, so that's 1R, risk, then rapport and reliability. I was able to maintain a reasonable rapport with the patient. The history is not reliable, so I would like to take a collateral history from the nurse. Okay.
Okay.
If there is no management or diagnosis given in the task, you don't need to say the diagnosis or management in here. But if the diagnosis was a task, this would be most likely a acute alcohol withdrawal causing delirium. Okay.
Okay. Okay. Thank you.
Thank you, Dr. Vinita. Take care. So that's for everyone. So I hope you guys understood how to take the history and how to present the MSc. Any question? how much time should we give to each task here? So in this kind of task, your main will be psychiatric assessment. So at least you can give, let's say, 5 minute, 30 second here. So even like 5 and 3 will be really good. Okay. If your patient is bothering a lot, even you can do it as 6 minute and 2 minutes. So you don't need more than 2 minutes to present MSc. There will be no prompt timer. So in exam, the prompt timer is only given when they already gave you in here that take a history for 4 minutes. So when they specify the time, then a prompt will be given after 4 minutes. But if nothing is written, then there will be no prompt. So once 8 minutes is done, then there will be a prompt that your time is finished. Yes, Dr. Hivza. So you can write key points. So for this kind of case where you're doing the MSc, the key point is aseptic J3R. So just write aseptic J3R, and in the front of that, write what are the findings you are getting. So rapport you can say, because patient was answering your question, so you can say that you were able to maintain a reasonable rapport with the patient. Not a good rapport, but reasonable rapport. That will be okay. Okay, so this is a very, very important case, comes in exam a lot, so different ways, but the cockroach case is a known case. So please make sure that you understand how to take the history. So we have written in here everything. Okay, so now I guess you have got a bit of idea that how to do this role play. So who wants to do the next one? Dr. Shafak, yes, definitely. Can you please unmute yourself and give me 1 minute? I will give you the case.
Yes, doctor.
Great. All right, Dr. Shafak, how are you?
I'm good. How are you?
I'm good, thank you. Okay. This is your case. Your 2 minute time just started.
Um, so um, so 2 minute is my preparation time, right?
That's right.
Oh, okay. Mm. 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 Should I start?
All right, so this is your patient. Your patient name is Sarah. You can start.
Hello, Sarah. My name is Dr. Shafak, and I would be your doctor today. So before starting, I'll make sure that whatever we talk about would stay between you and me, unless it's harmful for you or anyone else. So, Sarah, how may I help you today?
Nothing really. I just need a script of lithium.
Mm-hmm. Okay. So before writing another script, I would ask you a few questions. Is that okay with you?
Yeah.
Okay. So, Sarah, for how long have you been taking lithium?
10 years.
10 years. Okay. And do you know why are you taking lithium?
Yeah, got bipolar.
Okay. All right. For how long have you been diagnosed with bipolar disease?
10 years.
10 years. Okay. And so for last 10 years, have you been seeing your psychologist or a psychiatrist regularly?
Um, it's been a while. I have seen the psychiatrist.
Okay. Can you tell me when was the last appointment?
Mm, Maybe 3 years ago.
3 years ago. Okay. And any side effects of lithium, like any weight gain or any heart problem or any thyroid problem?
I don't know. I don't think it's working anymore. So
Okay.
I don't know.
Okay. So before giving you a script, I need to do a proper psychological assessment of you. So, so Sarah, can you tell me how is your mood been lately?
Uh, I just don't feel right anymore. It's just
Mhm.
feel lonely and sad all the time.
Okay, all right. And can you tell me how have you been sleeping?
Can't sleep. I just stare in my ceiling,
Mm-hmm. Okay,
wait for hours, but
okay.
I can't sleep.
And mm-hmm. Okay. And can you tell me, have you been eating properly?
No,
No, okay. And can you tell me, um, um, uh, do you see or hear or feel things which other don't?
no.
Okay. And so these are just screening questions we ask from all our psychiatric patients. So have you been thinking of harming yourself?
Yeah, the thought comes into my mind.
Okay.
Just don't
Any?
feel like
Mm-hmm.
it. I don't think I deserve to live anymore, and
Okay.
there's nothing I can achieve.
Mm-hmm.
So it's better I
Okay.
should just vanish.
Mm. All right. I'm sorry that you are feeling this way. Can you tell me, have you ever tried to suicide, or have you ever had previous attempts?
Yeah, I tried.
Okay. How many times?
Maybe 4 or 5 times.
Okay. All right. Do you have any plans now? Have you prepared
Yeah,
any
but
thoughts, or have you have any plans?
um, I don't know. Thought comes into my mind.
Mm-hmm. But have you tried to take action on any on those plans?
Not yet.
Okay, all right. And can you tell me, uh, uh, have you been enjoying things recently which you used to enjoy before?
No, I can't enjoy anything.
Okay. And can you tell me, uh, when we feel this way, we try to sometimes patients try to use alcohol or drugs. Have you been using them as a coping mechanism?
Yeah, it's just drink because that's the only thing that helps to
Mm,
sleep.
okay, all right. And can you tell me, have you been thinking of harming others?
No,
No, all right. And can you tell me, do you get any thoughts of like someone is inserting some thoughts in you or taking away some thoughts from your mind?
no,
All right. And can you tell me where are we at the moment?
hospital.
Okay. And can you tell me what time is it?
I can't remember.
All right. And can you tell me who am I?
Doctor.
Okay. And so do you think you need any medical help at this point?
No, I don't think so.
And okay. And if there would be fire in this room, can you tell me what would you do?
I'll just stay.
Mm-hmm. Okay. And can you tell me any how are the situations at home? Who do you live with?
Just with my partner.
Okay. And any support from your partner?
Yeah, yeah, he's a great man.
Okay, all right. And any past medical history other than bipolar disorder?
No,
Okay. And uh, just a question, sorry. Would I get a prompt time?
no,
All right, okay. So I would like to present my MSc to the examiner. So please excuse me, Sarah. Thank you for all the information that you have given to me. So examiner, I was
I'm
exam.
out.
Oh God, sorry.
All right, Dr. Sir. Yeah, no, that's fine. So you did very good. Let's do it. So let's see what you want to say in the MSc.
All right, okay. I thought I would be getting a prompt time.
No, you would not unless if it is not written on the question that take history for 4 minutes, you would not get a
Mhm.
prompt.
All right, okay. Mm-hmm. All right. So
You can start, yeah.
yeah. So I took a mental state examination of my patient Sarah. So her mood was she was sad, and I could not observe her. So I could not comment on the eye contact, and her speech was slow and sad, and at times she was a bit monotonous as well, and she was describing her mood as depressive and low, and the effect is also congruent with the mood, and she has evidence of anhedonia and poor appetite, and also sleep disturbance as well, and she has some content of guilt and hopelessness, and her thought form was a bit linear, and she had slow processing of her thoughts as well. I could not find any disorder of her thoughts, and I could not find any perceptual disorder, and she was oriented to the place and person, but not oriented to the time. And as she's at high risk of at high risk at the moment, because she does not have any insight of her medical condition, and also she has been previously attempting for a suicide, and at the moment again she is thinking of suicide as well. She doesn't give me any evidence of harming others, and she is at risk of self neglect as well. And yeah, that is my MSc.
Okay, thank you. And what will be the initial management for this patient? What would you do?
So I would apply the Mental Health Act at this point because she is suicidal at the moment, and I
Yep.
would try to admit the patient in the psychiatric ward, and I would treat the
What's the diagnosis?
hypomanic episode of bipolar disorder.
Okay, all right. Thank you, Dr. Shafak. So this was not a hypomanic because you have got all the features of depression.
Okay.
Hypomania and mania, the symptoms are same, right? So you haven't asked about any mania or hypomania questions, which is
Yeah.
basically we ask about like the patient will feel elated
Yeah. Risky
and
behavior.
euphoric. Yeah.
Mm.
So euphoria or elated, decreased need for sleeping, increased energy. They will also be very much goal directed. So they will enroll themselves in lots of activities suddenly. They will do risk-taking behavior like reckless driving, sexual intercourse with unknown people, gambling. So lots of
Mm.
reckless behaviors. So those will be the main features of mania or hypomania, which we can definitely ask in the history, especially there is management here. But this is about bipolar depression. So at the moment, this patient is having depression. So
Mm.
in your history, so you did really, really good, Dr. Shafak. The way of your, like the approach and everything is nice. It's just the timing would be different. So you can't take that much of a history when there is management in this case, because depression case is always slow. Patient doesn't answer you. So it takes a long
Mm.
time to do the history. So
Mhm.
even slower than what I was. So you'll just be very, very like angry with the patient, but you can't show that. You just need to go with the speed. So you can't speed
Mhm.
up because that's how the case is made. So in that situation, the better thing is like make sure not to miss the important thing. If there is some of the unimportant things are left, that's fine. Like the deletion of control, deletion of thought content, those are very unlikely will be the positive findings in here. So even if you miss those deletion question in the depression case, it's totally fine. Okay.
Mhm.
So the main thing that you can't forget, definitely delusion of guilt should be asked, but other delusion will very unlikely will be positive. So if you miss those delusion questions, don't worry, it's fine. But asking a little bit of depression and mania question will be important in here, especially when there is management. Because to give the management, you need the diagnosis. So the
Mhm.
diagnosis based on your assessment. So what would you do is the way I would start the case will be like this. So hi, Sarah. This is Dr. Shafak. I'm one of the doctor in this clinic. It's very nice to meet you. I understand from the note that you are here for your lithium script, right? Yes, doctor. Well, I'll be very happy to provide that, but I need to ask a few questions to understand why you take lithium and a little bit more idea about your mental health. I want you to know that whatever we discuss today, it is confidential between you and me. So is that okay with you if I ask you a few questions? Yes, doctor. So start in this way, make a rapport with the patient, and then the initial questions are very good that how you asked. So can you please tell me a little bit more about this lithium, how long you're taking them, and like have you got any side effects? Are you taking it every day? What's the dose that you are taking now? Have you ever had any side effect out of them? And how long you have been diagnosed with bipolar? When was that diagnosed? What was the symptoms back then? How many times you had to hospitalize for it? When was the last time? When is the last time you have seen your specialist? So these are initial questions. And then your psychosocial history will start with mood, sleep, appetite, suicidal question. Now, because initial few questions, you will get the idea that this is a depression, because patient will be very sad and low. Then you would not think about mania or hypomania question anymore. You would ask a bit of questions about the depression. So if you remember, we discussed a little bit about M-Psych caps. That's the depression question we ask. So in the M-Psych caps, we have mood, we have sleep, interest, guilt, energy, concentration, appetite, psychomotor retardation, and suicidal thought. Suicidal thought you have asked, mood you asked, sleep you asked, and then appetite you asked. So the only thing that we would need to add here, which is you have asked about interest and guilt, so that's good. So have you lost interest in things that you used to enjoy before? Do you feel guilty about anything? How about any lack of energy and lack of concentration? So you can also make one question and ask two symptoms together to save some time. Okay, so make sure that you ask all the M-Psych caps, especially if there is a diagnosis or management. And quickly ask about hallucination, forget about delusion question, and ask about insight, cognition, judgment. And if you're running out of time, even you don't need to bother about heads and sadman, other things. Quickly, you can ask about alcohol because that's important. And other than that, you don't need to ask heads and everything because you would be running out of time in this case. So then you go to the MSc and then say that you want to present the MSc of this patient. So appearance for today's session, you all of you guys can say appearance is not seen. Speech was slow and monotonous. There was no rapid pressured speech or disorganized speech. If you're running out of time, forget about the negative finding. Then after that, then emotion, mood was low, and the effect that I have observed is congruent with the patient's mood. There was no perceptual disturbance. Thought form was linear. There was no delusion. Insight and judgment was impaired. If you ask cognition, if it is impaired, then also say insight, cognition, judgment is impaired. Patient is high risk because of active suicidal thought. That's it. You don't need to explain anything else. And then I was able to maintain a good rapport with the patient, but the history is not fully reliable. So I would like to take a history from the patient's partner. Okay, and then thank the examiner and then talk to the patient that thank you, Sarah, for waiting for me. Now, based on the assessment, I believe at the moment you are having a major depression in which you feel low, you have lack of appetite, and say all the symptoms that you have got. Bipolar disorder, the diagnosis depends on sometimes you get depression and sometimes you get high or euphoric mood. At the moment, you are on the low part or low mood part. So for this kind of situation, because you are having suicidal thought, it is not safe for you to go home. So I want to admit you to the hospital. I will call the mental health team and a psychiatrist will come and assess you. And most likely they would like to admit you in the hospital for further management. And they might also want to start a antidepressant and also continue the lithium as a maintenance treatment. We will also organize some baseline blood test and a blood lithium level to make sure you are taking the lithium appropriately. If you want to call your partner or any other friends or relatives, please let me know. We will be happy to involve them. Do you have any questions? So very quick, see? So it has to be quick and concise. That's the idea. All right? Clear, guys? Did you guys understand how the case should be? Can we make any notes in the initial 2 minutes? No, you can't. You can make notes in the 8-minute times that you do the case, but nothing you can write in the initial 2 minutes. But Dr. Shafak, very well done, okay? Because the way of your approach is very good. So just keep up with the timing, you should be fine. Okay, so who wants to do the next one? It's interesting, right? The mental health and the psychiatry. Okay, Dr. Anwar, very good. So you can unmute yourself.
Yeah.
Dr. Anwar, can you
Yes,
hear me?
yes, I can hear you.
Okay, good. All right, so let's give you this case. So this is the case, and your 2-minute time just started. All right, Dr. Anwar, so your time just started. The patient's father name is John, and the patient name is Sam. You can start.
Okay. Hello, hi, John. Uh, I'm Dr. Hamza. I'm the doctor here. I'm so sorry to hear what was happening, and don't worry, I'm here to help you out and your son. And today I will be asking you just a quick question, few questions, and then we can talk about what we will be doing. So don't worry, okay? And I assure you everything we discuss here will be confidential, okay? So you don't have to worry about that. Before moving on, can I ask the examiner if Father John has the authority for discussing the patient's history and
Yes, go
his...
ahead.
Okay. So, John, can you tell me about what happened exactly? What's going on?
I don't know. You tell me because I just got a call from the police that he was being aggressive in public, and you can't let him out of the hospital. I just don't know why.
Hmm. So John, it looks like he was acting really aggressive in the public, and he was kind of causing trouble because people were getting bothered. And have you ever seen John act like this before? Anytime?
Uh, Actually, I have. I have been getting a little bit weird, like a bit worried about him because lately he's not himself, I think.
Hmm. How so would you say that he's not lately been himself? How has he changed?
It just like he keeps himself in that room. He doesn't come out. And most importantly, he's talking about some devil. Like initially I thought that he's watching a lot of horror movie, and then he just like getting into this. But
Hmm.
now I just don't understand.
I'm so sorry. Can you tell me exactly how long this has been going on? Have you noticed?
It's been going on for at least 3 months.
Oh, okay. And do you know if does he go to school? Does he go to work? Anything he does? What does he do?
He used to go to he used to do a bartender, but he stopped going to work for these 3 months.
Hmm. And you said that he's been in the room, and then that also that he's been maybe seeing things, you said, or hearing things. Is that what you're thinking?
Yeah, I believe that because I keep seeing whenever I go into that room, I see that he's like responding to someone. He
Mm,
keeps on saying that devils are talking to him. They
mm,
wants to do something to to him.
mm.
And also at some time he's told me that devils are just trying to trying to tell him that he needs to kill people because the
Oh,
city is not safe until he kills some people.
oh, I see.
So I just thought like he's just like being a 23-year-old, but
Mhm.
now I'm really worried.
I'm so sorry to hear that. Have you noticed that maybe he has tried to harm himself, or does he talk about that?
No, but definitely he has some thoughts of harming others. He's trying to control, but the devils are just talking to him consistently. And I think he's also sometimes he can see them because he keeps on seeing and looking at the ceiling.
Mm.
So he's just not himself. I'm just very worried about him.
Yeah, I'm sorry. Have you noticed, or do you know about his history, that maybe he's been using something, or has he had a history of it? Maybe some
No,
medicines or
he's
drugs?
always a very good kid. He's never used anything like that.
Okay. Do you know if there's any family history of mental health disorders, like maybe
No,
schizophrenia or anything like this?
no.
Okay. And so again, you said that this all been going on for 3 months, and he's been more and more isolated. He's been hearing and seeing things. He's been talking to someone and having ideas to people to kill people, and saying that the devil is telling him to do all of this, right?
Yeah.
Okay. And has he been able to take care of himself? Maybe eat well? Is he dressing well, do you think?
He's barely eating. He's not like taking care of himself. He hasn't showered himself for 5 days. Then we had to just like tell him to go to the bath. So no, he's not.
Oh, I'm so sorry to hear that. And what have you noticed about his speech as well? How does he speak? Is he making sense every time he speaks, or is he?
He answer my questions. He tell me everything,
Hmm.
but at times it just feels like he's not in touch with this world.
Oh, okay. All right. And again, just to clarify, this is the first time this has happened, like for the past 3 months, and hasn't been there
Yeah.
before, right?
No.
Okay. So, John, you see, all that you have told me, I really thank you for all the history you've been telling me. So let me explain the reason why we are going to admit him, or need to admit him in the according to the Mental Health Act. Basically, he's been having these thoughts of, killing people, and the devil, as he said, is telling him to kill the people. These are thoughts that are dangerous, not just for the other people around him, but for himself as well. So according to the Mental Health Act, we do have to admit him, to help him out, actually, not just to torture him, God forbid, or anything like that. It's just for his own well-being. Don't worry, because when we admit such patients, we will start them on medicines to calm them down. We will have a psychiatrist having to see him as well, and see what we can do regarding the treatment, what medicine we can start. Or moreover, when we admit him, we will also send blood tests, by the way, to just to see if he's got any organic cause that is related to these complaints. I'm sorry, I to the examiner that I haven't asked the questions regarding the organic causes. But so, John, basically, we'll be sending blood work for screening for infections, screening for thyroid problems, and so, tests like that, like full blood exam, a urea creatinine, electrolytes, as well as a thyroid function test as well. And just to be sure he's not taking anything, just to be sure, we're gonna send a urine test as well, okay, to test for substances and infection. So, that's why we really need to admit him. It's for his own sake and well-being. Okay, John?
Okay, sure. Thank you.
You have any questions?
When you think that he can go home?
Well, as soon as he's safe to go home, as soon as he's calm and he can talk to us clearly and really reinforce that he's not going to harm anyone or he's not getting
Thank
those
you.
thoughts.
Yeah. Very good, Dr. Anwar. You have done really well. So, I think yeah, I actually forgot to give you the prompt after 4 minutes, but you did well with the timing. It's good. Just a few other things I might add here is in this case, especially in online exam, you don't need to ask examiner anything because examiner will not answer anything if you
Oh.
ask. So you'll just waste your time. So
Mhm.
it's very good to ask about if the father, like when we talk about someone else, we need to make sure they have the consent. So you can always ask to the father, like, "Hi, John, I'm Dr. Anwar. I'm one of the doctor in this ED. I'm so sorry to know about your son. Do you know what's happening?"
Mhm.
He might say, "Yes, I just know that he's being here, brought by the police." So then
Mhm.
you'll say that, "I'm so sorry to tell that, yes, this has happened, and he is under our care at the moment. I need to ask you a few questions about him.
Mhm.
And before I do that, I just want to make sure that if you have the consent to talk about your son mental health condition." So then father will say, "Yes, I'm fine." uh, so you can ask father, and if father confirms he has the consent, that's more than enough. Okay.
Mhm.
So let's say even if they don't have consent, let's say fathers say, "No, I don't know, doctor, like if he has given me the consent." Still, you would say, "That's all right, because you are the next of kin, right? So I don't have any other choice but ask questions from you because he needs help." Okay,
Mhm.
because patient doesn't have any insight anymore, so his consent doesn't matter. So
Mhm.
in that case, you can definitely talk to father even if he doesn't have the consent.
Okay.
Okay, so once you have made sure of that, then you would ask questions as you have done. So duration is very important. So you
Mhm.
can give a context to the father that, "John, what actually happened today is that he was in a shop and he kept telling devil, get out." And the people were getting very harassed by him. And then the shop owner called the police. Police went there and brought him here for some for assessment of his mental health.
Mhm.
Okay, so I understand that it seems a little bit like it can seem excessive to you given how it has happened, but he needs your help, and he needs our help to get better. And
Mhm.
I would really appreciate your full cooperation in this regard. So is that okay if I ask you a few questions? I
Mhm.
want to make sure that whatever we discuss here, it is confidential. So you haven't given the confidentiality, which is very important. So
Mhm.
never forget about that. And then you ask about like, uh, so have you seen anything unusual about him for the last few months? Then the father will say everything that happened, and then
Mhm.
you can go with the flow like you did. Okay. So the main part to understand that, like, how long this is happening? Has it happened before? What have you seen abnormal? So does he hear anyone? Does he sees the, do you think that he is also seeing the devil? So you can always say, do you think that he is hearing the devil? If the father say yes, have you like, are you aware that if devil is trying to say something to him? So
Mhm.
try to dig in a little bit more about it if father doesn't give the information.
Mhm.
Okay. And once you have done that, then you just finish with your like normal history. So ask a little bit about suicidal thoughts and
Mhm.
all of them. Okay. So your main question will be focused on hallucination and delusion in this case,
Mhm.
not much about depression or even like in this case you are talking to the father, so insight, cognition, judgment, those will not be important to assess. Okay.
Mhm.
So the history is mainly us trying to find out as much information from the father. Then explain the father regarding the use of Mental Health Act in this case and why the admission is justified. So there is a lot to talk in here. So you would say, first explain the diagnosis. So say that, John, thank you so much for all the information that you have provided. I really appreciate it. From the history and today's incident, I believe that he is having a condition called acute psychosis, and most likely this is what we would call as schizophreniform disorder. The duration is 3 months, so we can't see schizophrenia yet, but he fulfills the criteria to be diagnosed as acute psychosis, mostly likely due to schizophreniform disorder. Do you know what it is? No, doctor. Well, in this condition, patients lose touch with the reality. They don't understand what is real and what is unreal in front of them. So they start to hear voices, they start to see things which no one can do, and they lack insight about their own medical health. In this situation, they are not only just harmful for themselves, but also for the general public or anyone around them. So that is the time when the Mental Health Act comes into place. And according to the Mental Health Act, anyone who displays such behavior which can harm themselves or the public, and there is no other alternative treatment that we have for him, at that time we can involuntarily admit that patient for their safety. So that's what we are trying to do in here, John. It is not about just like we are trying to force him to do anything. It is for his own betterment. What we are going to do is to admit him in the emergency department for now, but we are going to involve a acute mental health team for further assessment. The team involves a psychiatrist, psychologist, and a mental health nurse. They're going to come and review him in detail, and most likely because he has active hallucination that he seeing the devil, he wants to harm people. In those situations, most likely the psychiatrist is going to keep him under the mental health unit for until he gets fully better. Most of this time, they start to get better after starting an antipsychotic medication, and also with some psychologist input gradually over a few days to weeks. But this is important for him. Not only that, they will also organize a full organic checkup, including all the blood tests and urine tests that you have mentioned. And then say that, John, this is a difficult time for you. I understand that for any parents, it is one of the toughest time, and I can see you are stressed and you are upset. But please trust us. Please understand that this is important for your son, and he can get better. It is not that he's going to be like this forever. With appropriate treatment and intervention, he's going to be fine. And all we need is your understanding and support to make sure he gets the best effective treatment in the hospital. Okay, so say something really like pressing and like something like this, like any parents will be convinced. Okay,
Okay. Thank you.
thank you. There will be no timer, Dr. Anushka, so you don't get to see any watch in the exam. So many times the invigilator will give you a prompt timer after 4 minutes. So this case, because it is written in here 4 minutes, so after 4 minutes, invigilator will give you a prompt that your 4-minute time is up. Okay. So you guys are doing really good. So far, all of you who has done the cages, I'm really impressed how you have done it. So let's do another case. Anyone who is interested?
Dr. Arshan, can I ask a question?
Definitely.
So this question came on 8th of August, just 3 days ago, this one. And in this, there are 3 tasks. There were 3 tasks. So 4-minute history, and second was explain the process of the Mental Health Act to the father. and explain the reasons behind the admission of his son under the Mental Health Act. So last two tasks would be like the same, like what would we explain in the process and what would we explain in the reasons. I got it that you explained that he doesn't have insight and all that, but what would we say in the process of Mental Health Act?
Yeah, good question, Dr. Shafak. So the process is more or less the same. It comes into the explanation that we have done, which means that the process involves him to stay in the emergency department until he is assessed by an acute mental health team. And during this time, he will be under like mostly at the moment, because he's not aggressive, so he will be under a medical constraint, which means that like he can't go home or go outside until he's being fully assessed. And once he's assessed, he's going to be admitted most likely into the mental health team. So this whole process that you are talking about, how things are going to happen, that will be actually your second task. So you don't need to like say the process first and then the reason. So you can just make these things together in a way so that the process and the reason comes together, and that will be enough.
Okay, all right. Thank you.
Thank you. All right, so who wants to do the next one? Anyone? So we'll be doing a video case. So there is a video role play sessions that we do, which means that we would show you a video of conversation between a doctor and a patient, and then you would find out the important things out of it, and then you will present the MSc. So we will do something like that. Anyone interested? You can definitely try. So it is all about trying. Many of the people who has done today, they haven't done it just today. They have previously they have done, and gradually they gain the confidence, right? So if you can do role play in front of 70 people, you can do role play with anyone. And in exam, it becomes so easy because you are just doing it in front of a couple of people. So you can do mistake, but always try. Trying is the most important thing in these kind of role play sessions. Anyone? Very good, Dr. Nubaisha. You can unmute yourself.
Can you hear me?
A little bit. Can you increase the volume?
Yep, I just have a look. Sorry, how do I do
This is
that on
good.
here? You can hear me?
Yeah.
Yep, okay.
All right. Just 1 second. So this is your case. So you can read the case and then we can start showing you the video. Once the video is stopped, you'll need to present the MSc to the examiner. Okay?
So do I still have my 2 minutes or is it just
It's actually not needed because there is nothing you can yeah. So no need.
exactly,
So
yeah.
okay. So have you read the task?
Yep.
Okay. All right, just 1 second. So let's start.
Hello, Robert Smith.
Yeah.
Thank you for coming to see me today. I'm Dr. Stanley. I'm one of the doctors that works here. Obviously, anything that we say is confidential between us and the team that I work with, and your GP who's asked me to see you.
Okay.
I hear there've been some problems with your housing. Do you want to tell me a little bit about them?
Yeah, I've had all sorts of problems. I mean, where do you want me to start? My neighbours,
Mm-hmm.
police, people spying on me in my street. None of them will admit to it, but my neighbours, it's mainly them at number 9, but I've seen them talking to the ones at number 6 and across the road as well.
So when did things start to go wrong?
I don't know. I mean, you'd have to ask them. Well, like when they started properly, like deciding that they wanted me out of the street. I think it was a few months ago. It's been going on for months.
What makes you think they want you out the street?
Well, it's the harassment. It's the spying on me, putting bugs in my house, in my phone. And that at first they thought I couldn't hear it, but now they know that I know that they're there. Saying things about me through the window. Talking about what I'm doing. I know they're doing it. And whenever I leave my front door, woman at number 7, she's always there. She's clocking where I'm going and what I'm doing.
Why do you think they're doing that?
Well, I don't know. They're just. I think they want me out.
Mm-hmm.
I think they're testing me, and they're trying to find out how far they can push me. Basically, it's all part of some test. I don't know why. I don't know what for. You'd have to ask them. That's what I've said to the police time and time again. I've said to them, why are you asking me these questions? Why don't you just talk to them?
You said that your phone was clicking. What was that about?
A landline.
Your landline?
Yep. Somebody rings me or I ring somebody. Between 7 and 10 seconds in, I hear click, click, click. Click, click, click every time.
Any other explanation for that?
I don't know. What else? Well, it could be, but every single time, and then they're talking to me, and then they know what I've been saying down the phone.
How are they talking? Where are they talking to you?
Well, I can hear them next door. Oh, he's on the phone again. Oh, he's reading that book again. I can hear them saying it, and they know that I can hear them, and that's why they're doing it.
Okay, so just to summarise at this point, your phone's. Something's happening to your telephone. You can hear your neighbours talking about what
Yep.
you're doing, making a commentary on your actions
Every day.
every day, and you feel that there's some sort of reason for all their actions doing this. Any other things that you've got problems with?
Following me down the street. People following me when I'm going to the shop. It's happening more and more. I mean, I've tried to explain to my friends about it. They get really agitated. They think I'm off my rocker, but they don't see it. They're not living with it every day.
Okay. So your friends are worried as well?
Yeah.
So
Well, worried or, I mean, I don't think they're on it. I don't think, but they know a lot about what's been going. I don't know. Maybe the police have been talking to them or something, or maybe my neighbours have been talking to them.
Okay.
I don't know. Again, you'd have to ask them. But it's hard. It's hard to know. It's hard to know who to talk to because they all,
So
they're all involved.
So this started happening a few months ago. Has it had any other effects on your life?
Well, yeah.
Such as?
Can't really go out. Well, I can, but I know what's going to happen if I do. So I'm just trying to stay low key. I'm trying to stay out of people's way. I've hardly slept. I've hardly slept for the last, I don't know, I can't remember the last time I got more than 4 or 5 hours sleep.
So what disturbs your sleep?
I don't sleep until, I don't tend to go to sleep until after 2, 3, when I'm sure that they've turned everything off,
Right, okay.
Downstairs, and just can't, I'm worried about it.
Any problems watching the telly, listening to the radio?
Oh yeah. They're using the TV as well. They're using all. They've got all this technology, obviously. I mean, I know there's all these smartphones and whatever now. You know, all they need is one of them, and they can just. But yeah, TV. You know, they've got the local news. If ever I watch that, you know, there's always some little comment. There's always something they say in there at the end about what's been going on. You know, pretty much every time I turn the TV on now.
Okay.
I mean, it's it's all just the cable, isn't it? So they could, for all I know, they've just plugged it into that.
What do you mean the cable?
The cable TV. You know, it runs down the street. You know, everybody's got access to it if they know what they're doing. You know.
So obviously, this is all very distressing. All the different things that are happening. Can I take you back a little bit and just find out a bit more about you? I think your doctor said you're age 29.
Yeah, 29.
Yeah. Tell me a bit about where you were born, your upbringing.
All right, so that's the finish of the video. Now you'll get 2 minute time to deliver the MSc.
Mm-hmm.
So you can start.
Okay, so hello examiner, I'd like to present MSc for a 29-year-old male who's got a history of schizophreniform disorder. His appearance-wise, he's wearing a maroon jacket with a grey shirt, black pants, and shoes. He appears fairly well-kept. Sitting on the couch, appears very irritated, unable to sit still on the couch, is quite fidgety, displays some underlying aggression. He is maintaining eye contact at times. There seems to be good rapport built with the patient. He's not pacing around the room. His speech is loud at times, a little pressured. Volume seems to be normal. He's spontaneous and clear. His affect was not asked. Sorry, his mood was not asked, but his affect seems like he's quite, I wouldn't say elated, but he's quite concerned and worried. He's got delusions, perceptual issues, so delusions of spying, the police, his neighbors. There's delusions of commentary as well. He's saying he hears his neighbors constantly talking about him. His phone is there's bugs in his phone, and that he's being followed. Some thought control, the TV and radio, something about smartphones, and a cable TV reference. He displays a lot of paranoia as well, that people are following him with a phone that rings and he hears clicking sounds. This is affecting his sleep and his social interaction as well. He says he's been not able to leave the home. He's got poor sleep for the past several months. His insight wasn't specifically asked, but he seems to think all these thoughts and his delusions are real. Cognition was not assessed formally, but it seems grossly intact. And judgment, I'd say it's not great at the moment, given he doesn't seem to think there's something wrong with him. So the interviewer didn't really ask about suicidal thoughts. That's something else I would do. From this MSc, it seems like this patient is quite delusional, having auditory hallucinations. He would require most likely an inpatient admission, and to decrease his risk of harm to himself or others with these delusions he's having.
Thank you, Dr. Nupasha. So very good. So you have got most of the important information that is needed. So only thing I would say, if we follow the aseptic J3R here, so the appearance, you said it right. So patient was fidgeting, pacing, and all others. he was maintaining eye contact at times. The speech was normal most of the time, but sometimes a bit loud. And emotional, so anything that hasn't been assessed, you can just say that it hasn't been assessed, but if you feel something, you can always say that.
Yep.
Like in this case, you said emotion was not assessed, but the effect that I have observed seems a bit disturbed. Then we go for perception. So as in terms of perception, this patient was having an auditory hallucination because every time there is a ring, so he hears clink, clink, clack, 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 or something like that, like an unusual sound each time after someone calls him. And then the thought form was linear. In terms of thought content, he had a delusion of persecution or paranoid delusion because he thinks all the neighbors are spying on him. Delusion of reference, which means that everyone is commenting on him, whatever he is doing. So that's called delusion of reference. And we can say thought broadcasting maybe because TV newspaper is saying something about him. So apart from that, so you have insight, cognition, and judgment was not assessed. And then you would say the 3R. So patient is in high risk because of active hallucination and delusion. You can say the interviewer or the doctor was able to maintain a good rapport with the patient, and the history doesn't seem to be reliable. So in this case, it will be a good idea to get a collateral history from his friends and neighbors. Okay.
Yep.
So that will be the MSc presentation. You have got most of the things right. Just like remember, there is no deletion of comment or commentary. We said deletion of reference, and then the spying or someone is harming. We always say deletion of persecution or persecutory deletion or paranoid deletion.
Okay.
Okay, but otherwise, very good. Thank you. All right, so this is a bit of an idea about how like the video MSc can come in your exam. Okay, so let's go for another role play. Anyone interested? Anyone who wants to do a role play? Thanks, Dr. Anwar. We would see that if someone new wants to do a role play, that would be really good. Let's see if someone is there. So anyone, guys, just try. Use the aseptic J3R because by now, even if you haven't done the class, you know what the questions are. You just need to go with the flow. Anyone wants to do a role play? Very good, Dr. Esther. So let's try. You can unmute yourself.
Hello,
Hi, how are you?
Fine, thank you.
Okay, let's do a case. Just a second. Okay, so this is your case. Your 2-minute time just started. Okay, so this is your patient. Your patient name is John. You can start.
Hi, John. My name is Esther. One of the doctors in the emergency department, and I would like to ask you a couple of questions, if that's okay by you. And
Yeah,
I
sure.
promise, okay, I promise that whatever we discuss will be confidential between the two of us. Is that okay?
Mhm. Yeah,
Yeah.
sure. I just wanted to let you know that I'm totally fine. And it's just the police was just, they don't have anything to do, I think. So they just brought me from the street. I was not doing anything. I was just roaming around, was not harming anyone, not doing anything really bad. They just brought me here for nothing. So
No,
I'm sure you are quite busy with all other like patients in the emergency. So if you agree, I can just go. I can just go back to street. So I just don't want to waste your time.
no worries, John. It's just um a normal protocol to ask you a couple of questions, and if after asking you these questions you still feel like you don't need any help, then we'll see how to go from there. I'm really sorry the police harassed you and brought you in here, but just bear with us if you can. Can I go ahead, please?
Okay.
Okay. It said that you were roaming around the streets. Do you have a home? Where do you stay?
I live in the street.
Okay, how long have you been living in the street?
It's been 6 to 8 months.
Oh, okay. Really sorry about that. Is there any particular reason why? What happened to your home?
Nothing. I just like to stay in the street because God wants me to stay in the street and help people.
Oh, okay. Do you have any family? Do you have
Um,
a spouse or kids?
no, I don't want to be involved with this with this kind of thing because I am living a spiritual life at the moment.
Oh, okay. I completely understand that. Um, okay. So I'll just like to ask you a couple of questions, although they must seem strange, but please, I would appreciate if you can answer them. Is that fine by you?
Yeah, nothing is like stupid to me. You can ask me any questions.
Okay. So how has your mood been like?
Yeah, I'm good. I've been
Uh,
feeling okay. God is helping me to show the path.
Okay. And have you had any issues with your sleep or appetite?
No, I eat what I can get.
Okay. How do you obtain your food?
God help me to find the food.
Okay. And you're sleeping all right?
Yeah, I sleep where I can.
Okay. Do you have any issues with your life? You feel like your life is not worth living?
No, it is worth living. The God tells me to do things and I do it, and yeah, it's good.
Okay, and you don't have any suicidal ideas? You haven't thought of
No, definitely not. That's a
hurting
big
yourself or
sin.
hurting anyone else?
No, why I would hurt someone? God asked me to help people so that I can live my life. So
Okay.
definitely, I can't harm anyone.
Okay, all right, that's good. So I'll just want to ask, do you see or hear or feel things that others do not see, hear, or feel?
I don't know. Can't you also hear God? Because I can hear God all the time.
No, okay. What does God tell you?
Just to save the humanity.
Okay. And how is that going?
Yeah, it's going really good. I'm living on the street and I'm helping people as I can.
Okay.
But definitely
So,
some people are very jealous about it because they don't know what I know.
okay. That's sad. Um, do you feel like people talking about you or trying to harm you or
No,
inserting
they can't
any?
harm me, but definitely some people are talking about me because I can see everyone is looking at me. They're trying to comment on me whenever I'm walking past them, but they can't do anything.
Okay. So, do you feel guilty
No, why I
about
would feel
anything?
guilty.
Okay. Do you feel like you have special powers?
Yeah, I have because I'm the messenger of God.
Okay. Do you feel like you have a medical problem?
No, definitely not.
What time of the day is it, please?
If I'm not wrong, it's 9 p.m.
Okay, and do you know where you are and who you're talking to at the moment?
I'm in the hospital talking to the doctor.
Okay. If there were to be a fire in this room at the moment, what would you do?
Nothing. Fire cannot touch me.
All right. So, you take drugs or use alcohol or smoke?
No, I don't have any money, but if I would, then yeah, I would take some alcohol.
Okay. Do you have any medical conditions?
No,
Have you had previously been diagnosed of a mental illness?
no,
Okay. Do you have any family history of a mental illness?
no.
Okay. So can I assess you for this wound? I can see you have
Where
on
is the
your
wound? I can't see any wound. Where is the wound, you say?
I can see a wound on your foot. You can
Oh,
see that?
yes, I can see now. Yeah. Well, how did it happen? I
Oh, I
didn't
need
know
to.
that there was anything. Yeah,
Oh, okay. Do you have any other wounds on any other parts of your body?
I don't know.
Okay. You can remember having any trauma to the site?
No, I don't remember anything.
Okay. Meaning you don't know how long it has been there.
No,
Okay. Do you feel any pain around the area now?
no,
You do you experience varicose veins? Do you have varicose veins swelling of
no,
your
doctor. Time up.
veins? Uh,
Okay, Dr. Asad. So means that you need to finish the question when you feel that there is no question left. That's the
all right.
idea in the exam. So when
Yeah.
you need to think that what should be my question, that means the questions have been asked. Okay.
Okay.
So go to the
Yeah.
next task. Don't wait. So
All right.
present the MSc. That's fine. Let's see what you have found.
Okay. Thank you very much, John, for answering my questions. And I'll get back to you shortly after talking to my examiner. Hi, examiner. I would like to present the mental state exam of John, a 47-year-old male that was brought in by the police to the emergency department because he was roaming around the streets and he happens to have a venous ulcer on his foot. So he seems, I can't see his appearance, or I didn't see his appearance, so I can't tell for sure if he's well-groomed or unkempt, but I believe he would appear unkempt since he has been living on the streets. His speech is normal, no, not slow and not rapid. He says his mood is okay. For his, I can't really tell his affect since I couldn't see him, so I don't know if it's congruent with his mood. He seems to have some perceptual disturbances as he claims to hear God telling him to save humanity. He has some delusion of reference and grandeur as he thinks people talking about him, and he has special powers. He doesn't have any insights as he doesn't feel he needs medical help. He has good cognition to time, place, and person. His judgment is poor. I don't think he's of any risk to himself or to others. I was able to establish a good rapport with him. His history doesn't seem to be completely reliable, so I would like to take a collateral history from the police and people living around him on the streets, if that's possible.
Thank you, Dr. Esther. All right, so basically, like you got most of the important things. So just to give you a bit of idea, so you need to be a bit quick on the history, otherwise time will run out. So it is quite understandable because initially when you do this case, you will keep on thinking what should be the next question, so you run out of time. So do a lot of role play. This will not happen after you do like a couple of role plays.
Yeah,
As
thank
part
you.
of the history, do not say that you promise. So we never promise anything to the patient. We always say, let me assure you that this will be confidential. So do not use the term promise with a patient. And then the other questions would be, so when you start the history, just try to go with the flow as you did, mood, sleep, appetite, and other things. So when patient is talking about like he can hear gods, what is the other thing that we can also ask? We also want to ask if there is any visual hallucination. So can you see the god? Okay, so ask that question. So hearing God, does your God command you to do something specific to know if there is any command hallucination? And definitely we want to know if there is any visual hallucination. So can you see your God? And then after that, you ask all the delusion question in here. So do you think people are commenting on you all the time? Do you think someone is controlling your thought? Do you think someone is trying to harm you? Do you have any guilt? Do you think you have a special power? And we also should not forget about thought content, thought insertion, and thought broadcasting. So do you think someone is inserting or withdrawing thought from your mind? Do you think TV newspaper has some special news for you all the time? So those questions are always important for psychotic scenarios like this case. As part of the MSc presentation, the main thing would be, so the appearance, speech was okay, then emotion, well, that's all right. When you come to the perception, this patient was having a perception of like auditory hallucination, then no visual hallucination was there. Thought form linear, thought content, the patient had a couple of deletion, one deletion of reference because people is commenting on him, and then delusion of grandiosity because he thinks he has a special power. So that's the two important delusion. And also, there is a condition called delusion of jealousy. So if a patient say that the people are jealous about me because I am the messenger of God, then yes, we say there is a delusion of jealousy as well. Okay. And other than that, you will definitely that patient doesn't have any insight. You have to assess cognition, and then there is no judgment as well. The patient is a moderate to high risk because patient lives in the street, lack of support, and most importantly, there is active hallucination and delusion. So it is a moderate to severe risk patient. Doesn't mean that a patient doesn't have suicidal thought. If a patient has active hallucination, delusion, they are drug addict, they live on the street, lack of support, all are high risk. Okay.
Thank you.
Apart from that, we should also like the rapport will like that's fine, and reliability, there was lack of reliability in this case. So you did well. Just make sure don't forget about these main points. Okay.
Yes, thank you.
Thank you, Dr. Esther.
Thank
So
you, Dr. Shan.
class that we wanted to cover for today. There are lots of other cases which we'll do in our. There is another psychiatry role play session after the end of the psychiatry class. So in those sessions, we will do a couple of more MSc as well. Okay, but when you join the course, there will be like all the questions that is important for exam. We usually like post it in your portal, and in the portal you can go through all the notes about those cases. Okay, so do you guys have any questions about the course? Let me discuss about the course a little bit. So if you guys have any questions after that, feel free to ask. So we actually started the course from today. So our new course has started from today, and any classes after that is a part of the class. But everyone is like, you can join this 2 week session as free to get an idea about the course. So the trial class has been finished on 28th of July, and we did our psychiatry MSc theory on that session. There is recording available in YouTube and also in the Facebook group. The full course will include everything that you need to pass this exam. If you are aware, First Aid AMC Clinical has the highest passing rate for clinical exam. And the way that we covered the course, it actually includes each and everything that can appear in the exam. But definitely, no one can say that, well, just memorize some questions and just go for the exam. The preparation doesn't actually get like that. You have to know the basic, you have to know the cluster, and anything comes in the exam, you'll be able to do that case under that cluster. So we make sure you get it right, you know how to take a proper history, how to do physical examination, how to come to a diagnosis, making sure your approach is right for this exam. So we take care of everything. Okay? So the theory will be based on clusters. So you will get a cluster-based theory from the next class, which is your cardiology session. We do role play of the important cases. You also get recent 4-year sample cases discussion. So in your portal, you'll get more than 160 question solve classes that we have taken for years. So everyone who join the course, they get our past class recording as well, so that you can go through those sessions if you want. So that's a very, very important thing. I do not believe any course will give you this much access that we provide. Okay. So currently we are on the 160 role play videos in our session. So that's a huge amount of case. And that covers at least last 3 years sample questions. Not only that, every week you will also get 1 or 2 role play sessions, which is the important ones. And mainly what happens, we do a combination of theory and the random role play. So theory classes will go with its own flow. Role play session will go with its own flow. When you finish the course, you will find out everything is finished in its own way. So that is how we combine the theory and role play classes so that things make sense. But definitely, when you do a random role play class, especially the next class that you would do on Tuesday, that class will not make a lot of sense because you don't know a lot of cages, you don't know the approach of a lot of cages. So try to join the session, try to do role plays, and try to gain confidence out of them. Because if you can do a role play on an unknown case, that means that you can do anything in the exam. Okay? Physical examination is a very, very important thing for AMC clinical. Most of the first-time candidates fail on the physical exam, but we take 1 month physical examination class, and that's more than enough for any physical exam that can come in your exam. We also take online mini mock exam, usually every 6 weeks, and you will get class recordings in the software with 10 months video access, and all other materials will be there until you pass. We also take sessions on APRA registration, CV, job hunting, RMO campaign. So there will be a class coming up after this 2-week session is finished. So definitely join that class. You can also gain CPD points if you are a member of RSCGP or ACRAM. You get a course completion certificate, so that's also important. And again, if you have got placement for October, November exam, or even earlier than that, you can still join this course because once you make the full payment, we give you access to just the recently finished batch. So when you get that whole batch class recording, you can also finish your preparation even within 1 to 2 months if you just do the video recordings. The cost is $899 plus 10% GST fee. So 2 installations available if you join this time. Course duration is 5 months. Classes are 3 days a week, ideally Wednesday, Thursday, and Sunday from 7:30 to 9:30 p.m. Sydney time. Now, if you don't get to join the live classes, which are like half of our candidates can't join live classes, so they do our recordings. So we usually post the recordings of the live class 24 to 48 hours after a session. So you can definitely go through that, and that will be more than enough for your preparation as well. But if you are interested in role play, definitely join the role play sessions because that gives you like interaction with us and we can comment on your mistake. And people who do a lot of live session and role play, they usually pass in the first attempt. Now, if you can't do it, but you can at least do role play with your partners, that is also another alternative. But you have to do role play to pass this exam. Okay. So if you want to enroll, you can contact us. Either you can send a message in my inbox, or you can also, inbox means messenger, and also you can contact us by this email, which is firstaidamc4536@outlook.com. You can also read everything that we discuss from our website. So that is firstaidamc.com. And that's more or less anything that I wanted to discuss for today. Do you guys have any questions that you want to know? Dr. B, I would definitely say if you haven't got the placement, you would not get the placement for this year because for this year, placement is already done. So if you haven't got the placement yet, it means your exam is going to be next year anyway. So I would definitely advise that better to do at least 3 to 5 months preparation. Okay, because it takes time to go through all these cases. And there is a huge amount of case, trust me. So you need time to learn the clusters and everything, and 2 months seems a little bit earlier to me. But depends on anyone how fast you learn. But definitely, I would say that for regular people, for general population, it is better to take at least 5 to 6 months preparation. And Dr. Surya, at the moment, when you join the course, it is taking at least a week to get access to the portal. So please wait for our team to add you. But if you haven't sent us a message, definitely send a message in my inbox saying that you made an account in the portal, and then we will sort it out. The schedule of the classes, so it is very unusual, or it's not usually possible to give a 5 months schedule because things can change. But definitely we give you the idea that what will be the classes that we'll be taking in each month. And also we give the usually 1 month class schedule at a time. And Dr. Rupinder, yes, when we do the orientation class after 2 weeks free session, we will go through the portal and we'll discuss how to use it properly. But for now, there is a video in the Facebook group, on your Facebook course group, about how to use the portal. So you can also go through that. You don't need to buy any books because there is no books needed for AMC 2. The only book you would need is the handbook. So there is a handbook of AMC Clinical. So that one, you don't need to buy it. You can just, because I think we have already uploaded that one. So you just need to go through that because there are some questions in the handbook that you need to go through. But otherwise, there is no need of any book. The notes and the research that we are going to provide, that is your book. All right, everyone. So I hope you are enjoying the session. But if you want to join that course, I would definitely say within the next 1 week, please start the process because it takes time for us to to add you in the portal to give you the best experience. So if you wait for the last class, and then we would not stop because we will continue the classes from that 2 week session. It might take another week for you to get into the classes. So definitely, if you feel that this is the right course for you, go for it and start the enrollment process. I want you guys to understand that AMC clinical exam is a hard exam. And with this kind of exam, you don't take risk. You make sure you have at least 70% preparation because we're talking about a lot of money, right? So for a course, you need to have a money. For the exam, you are paying a lot of money. So be well prepared before you go for that exam because they are going to filter the most and the best candidate out of the candidates that's appear in the exam. So you need to be a well-prepared candidate. The other thing is that don't get scared because most of our students who pass the exam, they are first-time candidate and they pass with highest score. Most of them pass with 12 or 14 Ks. So now you just need 9 Ks out of 14 to pass the exam. But most of our candidates, they do like 12, 13, 14. So if you do what we are doing, if you make sure you are following the guideline, there is no way you would fail this exam. You have to trust yourself. You have to give it its own time to learn. Things will be hard initially for the first 2 months, but along the way, just like your AMC MCQ, it will get better. So you just need to trust us. You need to trust how you're doing. Okay? And Dr. Tamanna, next class is on Tuesday. So the schedule is provided in our First Aid AMC clinical group. So if you go to the First Aid AMC clinical group, you should be able to see the full schedule. So go to any of the featured section, you should be able to see the course. So this is the schedule over here. So 13th August, there will be a separate Zoom ID for our role play session that will be taken by Dr. Cynthia, who takes your role play classes. And then after that, you have classes on 14th, 18th, 21st, and 22nd. Okay. And Dr. Nisarg, so if you are a part of the course, the notes of this will be given to the portal. So if you open the portal, in the portal, there is a theory note section. And in the theory note, you can get to this class. If you don't find it in the theory session, because sometimes the role play classes we add in the sample question, so you can also search in the sample question part. Okay. All right, everyone. So we'll finish it here tonight, and Dr. Sintha will take the next class. I will not be there, so she will do some random role play with you. Try to attend the session. Try to understand how random role play works, and then I'll see you again on 14th with cardiology class. Thanks everyone for your active participation, and I'll see you again. Take care. Good night. Bye.